Last December, a nationwide recall was issued for certain infant ibuprofen. The liquid pain reliever may have had concentrations of ibuprofen that were too high and therefore could be dangerous. The affected lots were sold by CVS, Walmart, and Family Dollar. And of course, anytime a recall like that happens, safety becomes a concern, especially when it involves our kids. Here's Julie Musgrave with advice from a Fresno pediatrician about how to make sure you're up to date with everything you give your child.
Dr. Alper, thank you so much for joining us. Parents hear that there's been a recall on any sort of medication. It's probably a little jarring to hear. So what should be the first thing that parents do?
First thing, parents should contact their pharmacy because FDA and CDC and pharmaceutical companies, they usually call or approach pharmacy where the medication being distributed. They also could go on CDC website or FDA website, or in case of pediatric medications, they can check with American Academy of Pediatric website.
What are some symptoms maybe that parents should be looking for in their children if maybe they don't know that their medication is recalled, but they give the medication anyway? What should they look for?
Certainly, if you feel like if you used that medication before and you see any unusual stomach ache or headache or any unusual rashes on your child, you should contact your pediatrician first and, check on that. And certainly if child getting real sick, they should see immediate care at urgent care or children's hospital or emergency room.
Are there resources for parents to check and make sure they're staying up to date with everything?
American Academy of Pediatrics does have a website. A lot of private medical offices now, including our Northwest, does have a website, and so parents can check on that. And again, if a lot of parents have relationship with their pharmacist, so if they feel, again, something not going the way they usually, that medication work for their child, that they should contact, one of those people.
What about expired medication? Does the same go for that?
Expiration day on medication, usually it's posted on a box or on bottom of the bottle, and it was some study done and see, how long medication would work after expiration day. Some studies suggest that actually it does work for another 6 months to a year and sometimes up to 2 years. Certainly with pediatric population, we do not recommend to use any expired drugs, expired medications. And we do recommend for parents especially to clean their medicine cabinet every so often, so the child would not get, to those medications, especially expired medications.
And what about disposing? If you do find out it's been recalled or it is expired, how do you get rid of it?
So what they do recommend, again, they could contact pharmacies and ask, because if it was recalled, could be that pharmacies would like to have that medication back and, report to pharmaceutical company. Otherwise, they do what it's been recommended to get medication out and mix with something like dirt or use coffee ground or cat litter and put in a plastic bag, and then they could dispose to the regular garbage can. And the plastic containers itself could be thrown away, but we do recommend, to take your name off so it doesn't, come to people that you don't want to know.
All right. Safety first. We want to keep that in mind for our kids.
Absolutely.
Dr. Alper, thank you. We appreciate it.
Thank you, guys.